You need to leave this area immediately. Family members aren't allowed in the medical bay. Dr. Sarah Mitchell's voice cut through the sterile air like a scalpel, but she had no idea she was speaking to the woman who signed her paycheck. The clock on the wall read 3:47 p.m. In exactly 15 minutes, Dr. Mitchell would be packing her office, but right now she was too busy dismissing the quiet black woman in navy scrubs standing near bed 7. "Ma'am, I said you need to move." Sarah's tone grew sharper, more impatient. "This is a restricted area." Maya Johnson, 45, didn't flinch. She'd heard that tone before. 2 decades of building a healthcare empire had taught her exactly what that voice meant. She wore no badge, carried no clipboard, just the calm confidence of someone who belonged exactly where she stood. "I'm checking on my nephew," Maya said quietly, her eyes never leaving the young man lying unconscious on the gurney. "Family visiting hours ended an hour ago," Sarah snapped. "Security." Before we dive deeper into this moment that would change Metropolitan General Hospital forever, let me ask you something. Have you ever been told you don't belong somewhere you actually own? If this story resonates with you, hit that subscribe button and share it with someone who needs to hear it. Because what happens in the next 13 minutes will remind you that appearances can be dangerously deceiving. Maya Johnson had arrived at Metropolitan General at 3:30 p.m., not as the CEO of Johnson Healthcare Network, a $2.3 billion empire spanning 47 hospitals across the East Coast, but as an aunt. Her nephew Marcus, a 19-year-old college student, had been brought in after a car accident. She'd driven herself, no executive assistant, no security detail, no entourage. Just a worried family member in navy scrubs she'd grabbed from her car, leftovers from her residency days that she sometimes wore during surprise hospital inspections. The emergency department buzzed with controlled chaos. Nurses hurried between rooms, residents checked charts, and the steady beep of monitors created a familiar symphony Maya had heard in dozens of her facilities. She approached the nurses' station. "Excuse me, I'm looking for Marcus Johnson. He was brought in about an hour ago." The nurse, Jennifer Walsh, barely looked up from her computer. "Are you family?" "Yes, I'm his aunt." Jennifer's eyes flicked over Maya's appearance, the scrubs, the lack of jewelry, the calm demeanor. "Room 7, but visiting hours are over. You'll need to wait in the family area." Maya nodded and walked toward room 7. Through the glass partition, she could see Marcus hooked up to monitors, stable but unconscious. She stood quietly, observing not just her nephew, but the flow of the department she technically owned. That's when she noticed the patterns. Dr. Sarah Mitchell, the attending physician, moved with practiced efficiency between patients. But Maya watched as Sarah spent 12 minutes with a white family in room 3, explaining every detail of their father's condition, while rushing through a 2-minute update for the Hispanic family in room 5. In room 9, a young black mother waited for over an hour before anyone checked on her son's fever. Meanwhile, a white couple who arrived later were seen immediately. Maya had implemented diversity training across all her hospitals. She'd mandated equal care protocols. She'd personally overseen bias reduction programs. But here, in her own flagship hospital, the old patterns persisted. "Excuse me." Maya turned to find Dr. Sarah Mitchell standing behind her, arms crossed. "I told you family members can't be in this area." "I'm just checking on Marcus Johnson," Maya replied calmly. "And I told you visiting hours are over." Sarah's voice carried the authority of someone used to being obeyed without question. "You need to move to the family waiting area, now." Maya didn't move. She'd spent too many years fighting for respect to back down now. "How is he?" Sarah's eyes narrowed. "Are you his mother?" "I'm his aunt." "Then you'll get updates when we're ready to give them. Right now you're disrupting patient care." "I'm a healthcare professional," Maya said quietly. "I understand patient care." Sarah laughed, a short, dismissive sound. "Really? What's your certification?" Maya could have ended it right there. She could have pulled out her hospital ID, her medical license, her business card that read Dr. Maya Johnson, MD, CEO. Instead, she decided to see how deep the disrespect would go. "I have my MD," Maya said simply. "From where? A Caribbean school?" Sarah's tone dripped with condescension. "Look, I'm sure you're a good nurse or whatever, but real doctors don't lurk around patient areas without proper credentials." The words hung in the air like a toxic cloud. Around them, the emergency department continued its rhythm, but Maya felt the familiar weight of assumption, of judgment based on appearance rather than ability.
"Security to emergency department. Security to emergency department." Sarah's voice echoed through the PA system as she returned to the nurse's station. Maya remained by Marcus's room, her presence now marked as a problem to be solved, rather than a family member to be comforted. Security Officer Tom Bradley arrived within minutes, a middle-aged white man with the bearing of someone who enjoyed exercising authority over people he perceived as powerless. "Ma'am, you're going to need to come with me," Tom said, his hand resting casually on his radio. "I'm visiting my nephew," Maya replied, still calm, still controlled. "Visiting hours are over," Sarah interjected from behind the desk. "She's been told multiple times to leave the clinical area." "Is there a problem here?" Dr. James Parker, the emergency department chief, had appeared. Maya recognized him from board meetings, though he clearly didn't recognize her. "This woman is refusing to follow hospital policy," Sarah explained. "She claims to be a doctor but won't provide credentials. She's disrupting patient care." Dr. Parker looked Maya up and down, taking in the scrubs, her calm demeanor, her lack of visible hospital ID. "Ma'am, if you're medical staff, where's your badge?" "I'm not on duty," Maya said simply. "I'm here as family." "Then you need to follow family guidelines," Parker said firmly. "The clinical area is restricted." Maya had reached a decision point. She could reveal her identity now, end this charade, and address the systemic issues she was witnessing. Or she could let it play out, document exactly how her staff treated someone they perceived as having no power. She chose to wait. "I understand hospital policy," Maya said, "but I'd like to stay near my nephew." "Ma'am," Tom, the security officer, stepped closer, "you're going to need to move to the family area, or I'll have to escort you out of the building." The threat hung heavy in the air. Around them, other families watched nervously. Maya noticed a young black father near room 4 shifting uncomfortably, recognizing a scene he'd probably lived himself. "This is ridiculous," Sarah muttered to Jennifer at the nurse's station, speaking loudly enough for others to hear. "Some people think they can just walk into a hospital and demand special treatment." Jennifer nodded sympathetically. "Probably doesn't even have insurance." "Marcus Johnson, I bet it's a charity case." Maya's jaw tightened slightly, but her voice remained steady. "I'll wait in the family area," she said. As she walked toward the cramped waiting room, she heard Sarah talking to Dr. Parker. "These people always try to push boundaries. Give them an inch." Maya settled into an uncomfortable plastic chair, pulled out her phone, and made 3 calls. First, to her executive assistant. "Karen, I need you to pull the personnel files for Dr. Sarah Mitchell, Nurse Jennifer Walsh, and Security Officer Tom Bradley at Metropolitan General. Full employment history, disciplinary actions, patient complaints." Second, to her Chief of Operations. "Robert, initiate a surprise audit of Metropolitan General's emergency department. I want patient care protocols reviewed, discrimination complaints analyzed, and staff behavior assessed." Third, to her legal team. "Susan, I need documentation of everything that happens in the next 10 minutes. We may have a systemic bias problem that needs immediate correction." The clock read 4:02 p.m. In the clinical area, Sarah Mitchell continued her rounds, unaware that every dismissive comment, every rushed interaction with minority families, every assumption she made was about to cost her dearly. At 4:05 p.m., Maya's phone buzzed. A text from Karen. "Files ready. Dr. Mitchell has 3 formal complaints in the past year, all from minority families alleging discriminatory treatment.
Complaints were filed but marked unsubstantiated by administration. Another buzz. Security Officer Bradley has 2 documented incidents of excessive response to minority visitors, 1 formal reprimand. Maya stood up from the plastic chair and walked back toward the clinical area. Tom Bradley immediately approached her. "Ma'am, I told you." "I need to speak with Dr. Parker," Maya said calmly. "He's busy with patients. You can make an appointment through administration." Maya smiled slightly. "Actually, I think he'll want to speak with me now." Something in her tone made Tom hesitate. Maya walked past him to the nurses' station where Sarah and Jennifer were updating charts. "Dr. Mitchell," Maya said quietly. Sarah looked up, irritation flashing across her face. "I thought we were clear about—" "We need to talk," Maya interrupted gently, "about Marcus Johnson's care, about hospital protocols, and about the future of this emergency department." "Lady, I don't know who you think you are." "Dr. Maya Johnson," Maya said, her voice carrying clearly across the department. MD from Harvard Medical School, residency at Johns Hopkins, fellowship in emergency medicine at Massachusetts General, and CEO of Johnson Healthcare Network. The silence that followed was deafening. Sarah's face went pale. Jennifer's hands froze over her keyboard. Tom Bradley, who had been approaching with backup security, stopped mid-stride. "I own this hospital," Maya continued, her voice still calm but now carrying unmistakable authority. "I own 46 others just like it, and for the past 30 minutes I've been documenting exactly how my staff treats families they assume have no power." Dr. Parker appeared as if summoned by the sudden quiet. "Dr. Johnson? I didn't know you were—" "No one knew," Maya said simply. "That was the point." She turned to address the entire department, her voice clear enough for everyone to hear. "My nephew was brought here after a car accident. I came as family, not as CEO. I wanted to see how we treat people when they can't fight back." The department had gone quiet. Nurses stopped their rounds. Residents looked up from charts, and families in the waiting area pressed closer to hear. "Dr. Mitchell," Maya continued, looking directly at Sarah, "you assumed I was uneducated because of how I looked. You dismissed my medical training. You called security not because I was disruptive, but because I didn't fit your image of who belongs in your clinical area." Sarah's mouth opened, but no words came out. "Nurse Walsh?" Maya turned to Jennifer. "You assumed my nephew was a charity case without checking his insurance status. You made assumptions about our family based on our name and appearance." Jennifer's face flushed red. "Officer Bradley," Maya addressed Tom, "you were prepared to forcibly remove a family member whose only crime was caring about their relative." Tom stared at the floor. Maya walked to the center of the emergency department, commanding attention without raising her voice. "This hospital employs over 3,000 people," she said. "We serve a diverse community, and every patient who walks through these doors deserves the same level of respect, care, and dignity, regardless of their appearance, their insurance status, or their perceived social standing." She paused, letting her words sink in. "Dr. Mitchell, your employment with Johnson Healthcare Network is terminated, effective immediately. In the past year, you've accumulated 3 formal complaints from minority families. Those complaints were dismissed by administration, but I've reviewed the cases personally. The pattern is clear and unacceptable." Sarah's legs gave out slightly and she gripped the nurse's station for support. "Nurse Walsh, you're suspended pending a full review of your patient interactions. Your comments about charity cases and these people are documented and inexcusable." Jennifer's eyes filled with tears, but Maya wasn't finished. "Officer Bradley, your contract with our security firm is terminated. Your response to this situation showed a clear bias in how you approach different families." Maya turned to Dr. Parker. "James, you're the department chief. These problems happened on your watch. We need to talk about systematic changes, starting now." Dr. Parker nodded quickly. "Of course, Dr. Johnson, whatever you need." Maya pulled out her phone and dialed her operations chief. "Robert, implement Protocol 7 at Metropolitan General, effective immediately." She hung up and addressed the department again. Protocol 7 means this facility will undergo a complete bias audit. Every staff member will receive mandatory anti-discrimination training. Patient complaint procedures will be overhauled, and we're implementing an anonymous reporting system for families who experience discriminatory treatment. Around the department, staff members exchanged nervous glances. Furthermore, Maya continued, we're establishing a patient advocate position. Someone who ensures every family receives equal information and equal respect, regardless of their background. She walked over to the young black father she'd noticed earlier, who was still waiting for updates about his son. "Sir, have you been given an update on your son's condition?" The man shook his head. "We've been waiting 3 hours. They said someone would come talk to us, but—" Maya turned to the nearest resident. "Get this family a complete update on their son's condition. Now." The resident hurried away. Maya addressed the department one final time. Excellence in healthcare begins with respect for every human being who enters our facility. That's not negotiable. She walked back to Marcus's room where her nephew was beginning to stir. A new nurse, one who hadn't been involved in the earlier incident, approached respectfully. "Dr. Johnson, would you like me to get the attending physician to update you on your nephew's condition?" Maya smiled for the first time that afternoon. "Yes, thank you." As she sat beside Marcus's bed, her phone buzzed with messages from hospital administrators across her network. Word was spreading quickly about the changes at Metropolitan General. By evening, the story would be trending on social media, not because Maya sought attention, but because other families came forward with their own experiences of bias in healthcare settings. 3 months later, Metropolitan General would be recognized as a model for equitable patient care. The protocol changes Maya implemented that day would be adopted across all Johnson Healthcare Network facilities. Dr. Sarah Mitchell would struggle to find employment at other hospitals as word spread about the circumstances of her termination. Jennifer Walsh would complete sensitivity training and be reassigned to a non-patient-facing role. Tom Bradley would find work in a field where his biases could do less harm. But the real victory wasn't in the individual consequences, it was in the systemic change that followed. Hundreds of families would receive better care because one woman refused to accept that respect was optional. As Maya watched Marcus's vitals stabilize, she reflected on the lessons of the day. Power wasn't about titles or badges, it was about using whatever influence you had to protect those who couldn't protect themselves. The clock on the wall read 5:15 p.m. In less than 2 hours, Maya had transformed not just one hospital, but sparked a movement that would touch thousands of lives. Sometimes justice doesn't wait for the right moment. Sometimes it arrives dressed in navy scrubs, carrying the quiet authority of someone who's tired of watching good people be treated badly. If you believe everyone deserves respect in their most vulnerable moments, share this story. Subscribe to Legend Files for more stories of hidden power revealed. And remember, you never know who's watching when you think no one important is around. The legend isn't in the title you carry, it's in the dignity you protect.